Hello, everyone. Good afternoon. Greetings of the day. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. Today, we are diving into a topic that touches everyone under the sun, literally. We are here to talk about the importance and role of sunscreen in our daily skincare routine. Did you know that only about 30% of adults and even fewer children regularly use sunscreen when exposed to the sun? With skin problem rates on the rise, understanding the significance of sunscreen is more crucial than ever. Sunscreen isn't just about preventing sunburns, it's a powerful shield against harmful UV rays that can lead to premature aging, wrinkles, hyperpigmentations, most importantly, skin cancer. Yet, many of us still have questions about which sunscreen to choose, how often to apply it, and its long term benefits. Whether you are a skincare enthusiast or just starting to explore the world of sun protection, let's unlock the secrets of sunscreen together and embark on a journey towards sun safe skin. That's why we are thrilled to have Dr. Sujay M from Bengaluru with us today. She'll be sharing her expertise, insights on sunscreen. So, Dr. Sujay M, an esteemed figure in dermatology who embarked on a journey fueled by a passion for dermatology and a commitment to exceptional patient care. Currently serving as the founder and consultant dermatologist at Medicare Skin and Cosmetic Clinic in JP Nagar, Doctor has been a cornerstone of the clinic's success since its inception in 2005. Her expertise lies in clinical dermatology, aesthetic dermatology, and dermatosurgery, with a specialization in laser procedures certified in various dermatological and aesthetic techniques. Dr. Sujay M continuously strives for excellence, ensuring her patients receive the highest quality of care. Actively engaged in professional development, she is also the member of esteemed organizations such as the IABDL and actively participates in the Bangalore Dermatological Society. With a wealth of experience and a dedication to advancing the field of dermatology, Doctor stands as a beacon of expertise and compassion in the medical community. Welcome, Dr. Sujay. It is our privilege to host you today.
Thank you, Samita. Thank you for a kind introduction.
Thank you, Doctor, for taking out your valuable time for us. Because today we are going to indulge in a very important communication, very important session. Because we are going to talk about sunscreens, and again, because mostly it's the summers throughout our country, and sunscreen does become even more important. But what I would like to ask you as the very first question of the session, Doctor, is that why do we need to use or apply sunscreen on a regular basis?
See, sunscreens are used like not only to protect from the outside UV rays. So even when we are indoors, we are exposed to the UVA rays. So the UVA rays is a type of UV rays which penetrates the windows and it is present in the daylight. So this also can cause some changes in the skin, like it can penetrate into the deeper layers of the skin, and it can cause the collagen breakdown. It can affect the elastin tissues. So it can cause premature aging, the pigmentation, and also some kinds of skin cancers. So to protect the skin from these changes, sunscreens have to be used every 2 hours once, even when indoors. So this gives the maximum UV protection for the individual.
Right. So sunscreen also works as an anti-aging cream, right?
Yes.
So it goes a long, long way in improving our skin texture and safeguarding our skin. The thing is this, doctor, that as you said, irrespective of the fact whether we are going out under the sun or we are staying indoors, we need sunscreen. But mostly people feel that as it is sunscreen, it will protect us from the harmful radiations, coming out from the sun, and thus they feel if I'm working inside my house, I'm on work from home mode, or I'm working in a controlled conditions in my offices, etc., where AC is there, natural light is not coming, then my belief will be definitely, I mean, that, why do I need sunscreen? I'm just working in front of a laptop, or I'm working inside the kitchen, or I'm not doing at all. I'm just sitting in the house. Why do I need sunscreen? So, do these laptops, the gadgets, the screen time is continuously increasing because, so do they also emit harmful radiations?
Yes. See, initially, to say the sunscreens were introduced only to protect the skin from sunburns. So, as we have progressed and we have been using sunscreens to prevent other indications like pigmentation, aging, wrinkles, sagging. So, these are the indications for which we are using sunscreens extensively for now. So, yeah, definitely, even when you're indoors and you're sitting in front of the laptop or your system, they also emit some amount of UV rays. And also, this the visible light also contains this blue light. Okay, it is a range in the visible light spectrum, so which also can cause something called as a delayed hyperpigmentation. So even though a person is sitting indoors, sitting in front of the system throughout the day, they are prone for the aging changes and uh, pigmentation on the skin. In fact, as they are sitting continuously for long hours, the risk is more. So that's the reason why we have to use sunscreens every 2 hours once, even when we are indoors.
Right. So unless and until we are in living in dark, we need to use sunscreen on a regular routine basis. Religiously, we need to apply sunscreen. As you just pointed out, we need to apply in every 2 hours. Reapplication of sunscreen in every 2 hours is what is necessary. We would like you to shed some more light about how much amount to be applied, how much time before we are stepping out we need to apply, and when to reapply, doctor.
See, coming to the quantity, it should be a generous application. So when I say generous, it is about like, for example, for the face and the neck. So you need around 1/4 teaspoon of the sunscreen to cover this whole area. So in case you want to cover the face, neck, and the arms, you need around half a teaspoon. So in this way, like based on the area, the amount required uh, depends on that.
Okay. And when to apply, when to reapply, doctor?
So it ideally any sunscreen, like whatever the SPF it is like it has to be reapplied every 2 hours once. And if you are stepping out into sunlight, 20 minutes before leaving, you need to apply the sunscreen. So this usually applies for the chemical sunscreens, like where it takes around 20 minutes for its action to start uh, to work as a sunscreen. But for physical sunscreen, you can apply and then leave immediately.
Okay, so there are these two types of sunscreens, physical and
Yeah.
chemical. What are
So there are, yes, there are physical and chemical sunscreens. So they usually physical sunscreen, they act as a layer on the surface of the skin, and they act as a shield. They work as a shield, and they do not allow the UV rays to enter the skin. In fact, they reflect the UV rays which falls on the skin, uh, and thus it helps in the UV protection. Whereas this chemical sunscreen, they get absorbed into the skin and they convert the UV rays into heat and it releases uh, out of the skin. So that takes some time for its action to start. So that's why the chemical sunscreen and using chemical sunscreen, you need to apply 20 minutes before leaving out.
Fair enough. Doctor, when we go out to buy a sunscreen, there are so many informations written on the box or on the tube of the sunscreen. The SPF is something we understand, sun protection factor, though we don't know what should be the ideal sunscreen SPF factor. But then, apart from that, also there are so many things, star rating, broad spectrum, or tinted, etc. We would like you to tell us what are the basics that we should go for when we are buying a sunscreen for ourselves.
So sunscreen, ideally, it should be a broad spectrum sunscreen. So it should protect the skin from the UVA, UVB rays, and also from the visible light. So usually a broad spectrum sunscreen, usually, ideally for the Indian skin, like usually a sunscreen of around SPF of 30 should be fine. So when usually a 30 SPF, it gives around 97% UV protection. Or if you want to use a little higher SPF also, even though we choose a 50 SPF, it provides around 98% protection from the UV rays. Um, and like the UV, for to know about the UVA protection, so we have something called as a PA plus plus written on the box. So you have to see the number of plus which is there. So when I say PA plus plus, it tells about the ability of that sunscreen to protect from the UVA rays. Okay, the more number of plus, the ability to protect from the UV rays is better. So basically, you need to look for the SPF, the PA plus, and also we need to see whether it is a non-comedogenic or a water resistant. So these kind of products can remain on the skin for a longer duration, and they give a better UV protection.
Now, coming back to SPF, as I said, people are aware that there is a thing in sunscreen which is called SPF, which is measured in numerics starting from 20 to 30 to 40, 50, and so on and so forth. Now, my question to you is, Doctor, how to decide what SPF is ideal for us?
Okay, so in case you're a person who are indoors most of the time, do not have any outdoor activities, so you can ideally choose a sunscreen with a SPF of 30 and PA 3 plus or 4 plus. Uh, so this is the more and these you can look into, and also like based on the type of skin, like in case you have a acne prone skin or a oily skin, you can use the products which mention as non-comedogenic water resistant sunscreens. Or in case if you are doing some water activities, swimming, or if you're sweating too much, definitely water resistant sunscreens have to be chosen. And when you're especially sweating or swimming, sunscreens need to be applied more frequently. So maybe when I say more frequently, when you're sweating, the effect of it lasts only for 40 minutes. So it has to be reapplied every 40 minutes when you're sweating or swimming. So,
Then
and
there are,
those who,
yes,
especially
yes,
those
Doctor.
who are outdoors for longer duration, maybe they can choose a sunscreen with a higher SPF. We do get sunscreens with around 50 SPF, 80 SPF. So these kind of sunscreens can be chosen, and with the maximum PA plus.
Mhm. Nowadays, sunscreens are also coming with an SPF of 90, 90 plus.
Yeah.
And they also mentioned that they are going to be active for 8 hours or 6 hours. They also claim that. So, do they work that way? I mean, if we choose a greater SPF, say 90 plus, it's going to give us more sun protection. Or if we go for these 8 hour protection, we don't need to reapply. Is it the way?
See, well, see, if an 30 SPF sunscreen can provide around 97% protection, the 100 SPF can provide 99% protection. But whatever, even though it's a 100 SPF, it doesn't provide 100% protection. And also, the protection depends on the quantity you apply also. So if you are applying a sufficient quantity, and if you are not sweating, then it can last a little longer. But usually with our activities where we tend to sweat, the sunscreens gets drained off easily. So that's why we need to apply it every 2 to 3 hours once, so that the effect of the sunscreen is maintained continuously for long hours. Especially if you're
Okay.
outdoors, it needs even more frequent application, maybe even once in 40 minutes or once in an hour. So to
Mhm.
keep it like at the like at an efficient level, it
Right.
needs to apply more frequently.
Okay. There are so many people, doctor, who are not using sunscreen as a regular routine thing, and they have so many complaints or excuses for not using sunscreen on a regular basis. They say that many of them don't like the white cast, or many a times they feel that it's making them sweat a lot, or many a times, they'll say that probably it's making my skin dull or patchy. So there are so many excuses for not using sunscreen. How would you like to address these things?
Yeah, definitely the sunscreens has to be chosen based on their type of skin also. So in some people, the physical sunscreen suits better for some people, where uh, like though it causes a white cast, nowadays we have this micronized zinc oxide or titanium dioxide available in the physical sunscreens. So they usually do not leave white cast. Okay, they in fact they work like a foundation. They form a thin layer on the skin. It doesn't look very patchy also. And if it is applied, maybe if it is very thick and it is giving a patchy appearance, maybe they can apply a layer of moisturizer and then apply a sunscreen over it. That allows it to spread more easily on all over the skin, and that can make them feel much better. So, and sometimes some people, when they are using these chemical sunscreens, they complain that their skin is getting darker. So that is because some reactions which happen in the skin can make the skin dark. In such people, also the physical sunscreens are more suitable.
Okay. Now,
So,
doctor, can we use or apply sunscreen on children or kids?
uh, yes, sunscreens for children usually it's recommended after 6 months of age, and we generally recommend physical sunscreens only for children. So as it doesn't get absorbed into the skin. It just forms a layer on the surface, and it acts as a protective shield.
Right. Many times we have seen people using, physical barriers like caps, sunglasses, hats, cotton scarves, etc., instead of using sunscreen. So, do they also work as sun protection guards, or we need sunscreens anyhow?
Definitely. In fact, we can tell that they are better sunscreens than the sunscreens which are available, where
Hmm.
in the form of applications. So, in fact, those kind of sunscreens like cap, full sleeve dresses, all these things give 100% sun protection, but they should be made up of a thick fabric, and it should be an opaque material. So then that definitely gives 100% protection from the UV rays. But the areas where we cannot cover with the clothing always has to be covered with sunscreens.
Okay. And, many a times people are so active in various physical activities, whether going to gym or they are going for swimmings, etc. Specifically for swimming, you have already explained it in length that what kind of sunscreen and how often we need to apply sunscreen. But if a person is sweating a lot, or he or she is involved in a sports activities, or their exposure under the sun is much more than rest of the people, like people who are on field, salespersons, media persons, etc., who are under the sun for a longer time. Uh, what, in addition of applying a sunscreen, they can do, and even with sunscreen, what kind of sunscreen they should go
See, definitely when someone is outdoors continuously, I recommend them to take a physical protection as much as possible, like wearing full sleeve clothing, wearing a hat with a broad rim. Along with this, they can apply sunscreens, like they can use a little higher SPF sunscreen, 80, 90 also they can use, so that they can remain on the skin for longer, and they have a better UV protection than a lesser SPF sunscreen. And uh, yeah, and definitely as they are sweating more, they have to apply it at least hourly. they need to reapply. They need to carry with them, and they have to reapply every hourly so that they have the maximum UV protection.
Nowadays, clothes and apparels are also coming where they claim that it can give you some amount of sun protection. So, especially for sports persons or people who are riding, biking, etc. So, is it a better way to go for these kinds of clothing?
Definitely. So if you're able to cover with thick opaque clothing, that gives you a 100% protection from the UV rays and can definitely prevent sunburns or any like even skin cancers, which can happen when on chronic exposure to direct sunlight. So that
Hmm.
can be prevented. And also hyperpigmentation is one of the common uh,
Right.
side effects which happens with exposure to sunlight. So that can definitely be prevented.
As you just mentioned about hyperpigmentation, melasma is very common in our society, in our country, and especially women are, facing this kind of skin condition, hyperpigmentation or melasma. So, can again sunscreen be used as a precautionary measure or as a preventive measure?
Yes, definitely, because melasma is one of the common pigmentation problem which happens with exposure to sunlight. Sunlight is one of the main reason for uh, the hyperpigmentation or melasma, along with other causes like hormonal imbalance or certain medications, which can also aggravate the chances of melasma. But definitely, use of sunscreens is very much recommended to prevent hyperpigmentation, melasma.
Mhm. Now we also see people who are acne prone or who are having acne, and they say that I don't want to layer up my acne with these sunscreens. So, are there specialized or customized sunscreens for such people who are acne prone?
Yeah, acne prone skin is generally a sensitive skin. So usually
Hmm.
for sensitive skin, we recommend the physical sunscreens which do not irritate the skin. So otherwise, sometimes when we apply the chemical sunscreen on a sensitive skin, there could be some amount of irritation, redness which can happen. That can be taken care of with the application of the physical sunscreens. So for sensitive skin, acne prone skin, we recommend a physical sunscreen.
All right. We see a lot of people using makeup on a regular basis. Many a times, it's also their, something which is associated with their profession. Now, in case they are applying makeup, what should be the order of applying sunscreen? When to apply sunscreen, and on sunscreen, is it advisable to apply makeup, and how to reapply if a person is already having a made up skin?
Okay. So whenever you have to apply the makeup, usually when we do this our skincare routine, first we cleanse our face. Then, like if we have any serums to apply, like the vitamin C serum or the hyaluronic acid serums, so that will be the next layer. Above Above the serums, we need to apply the moisturizers, and then comes the sunscreen. And above the sunscreen, we can apply the foundations, the concealers. All these can be applied above the sunscreen.
Okay. We have a viewer with us, Pooja. She is having a question regarding sunscreen. Is sunscreen necessary on cloudy days?
Yeah, even though it is cloudy, the UVA rays can easily penetrate the clouds. So as I said, it can also penetrate the windows. It also penetrates the clouds and it reaches the Earth's surface. And only around 20% of the UV rays is blocked. 80% of the UV rays is still reaching the Earth's surface. So definitely sunscreens are needed even on cloudy days to prevent, as I said, to prevent as an anti-aging cream or to prevent pigmentation, tan. Uh, so for these indications, definitely sunscreens are needed even when indoors or even on a cloudy day.
Right. And I'm sure the same goes for winters as well, I suppose.
Yes, yes. Whether it is winter, summer, or rainy season, sunscreens are needed to be applied generously and repeatedly for the best UV protection.
Okay. We have one very interesting question by Swetha. Her question is: does sunscreen affect vitamin D production or vitamin D absorption?
Usually, sunscreens does not block the vitamin D production. So, uh, so it is okay. So many studies also have been done proving that vitamin D production is not blocked with the application of the sunscreen. So it is okay to apply the sunscreen on a regular basis. So nowadays we have many people having vitamin D deficiencies. Even in people not using sunscreens, there's a lot of vitamin D deficiency. So in such people, we can definitely recommend vitamin D supplementation. So that
Right.
can help in supplementing the vitamin D levels in the body.
Right. We have Karthik with us. His question is: does broad spectrum sunscreen protect against UVA and UVB rays both?
Yeah, broad spectrum sunscreens, they protect against both UVA and UVB rays. So as I said already, the SPF tells the ability of the sunscreen how much it can protect from the UVB rays, and the PA plus it tells how much the sunscreen can protect from the UVA rays. So any sunscreen should have an SPF with PA plus. That is the ideal sunscreen.
Okay. Simran is here with us. Her question is: are there any situations where sunscreen might not be effective, like when swimming or sweating?
See, the sunscreens, they are effective. You should choose water resistant sunscreens. If you're swimming or sweating, you have to just look into the label which mentions water resistant. If it is a water resistant sunscreen, it can remain on the body for at least 40 minutes. So it needs to be reapplied after 40 minutes.
Okay. Doctor, many parts of India is having or is going to with the summer vacations in a couple of days, and we all are, going somewhere or the other. Some of us are going for beach vacations, some of us are going for hill vacations. My question to you is: when we are going for beach vacation, we make it a point to carry a sunscreen with us and, apply sunscreen on all the body parts that's exposed. But when we are going uphill, how important it is to use sunscreen there?
Yes, definitely. As we go uphill, the reflection of the sunlight is more and the UV rays is very strong. So you have to apply, probably you can choose a higher SPF sunscreen and apply it more frequently for a better UV protection. And as far as possible, try to protect with protective clothing. So especially an uphill, definitely the sun rays is very harsh. A physical protection with a proper clothing is the best way. But wherever you're not able to use clothings for protection, especially the face and the neck, which is always exposed, it's better to use a sunscreen with a higher SPF and a repeated application. More generously and repeatedly applying the sunscreens gives you the best UV protection.
Right. Sunscreens are again, medicated, and there are sunscreens by, cosmetic brands. So, which sunscreen do you prefer, and which way we should go?
See, the medicated sunscreens, what is available, they have uh, like usually there is a label which mentions the ingredients and how much ingredients are there. So we know exactly what we are using. So how much UV protection it is giving and what ingredient we are applying on the skin. So in this way, medically prescribed sunscreens are better and more effective than the over-the-counter sunscreens. So and also when you get a medicated sunscreens, you also consult a doctor who can explain to you how to use the sunscreen, and you are more aware of the way of using the sunscreens and the effectiveness of the application will also will be better. And as the person is counseled by a doctor or dermatologist, he'll be more serious in applying the sunscreens in the proper way advised. In such way, I have seen that some people who take sunscreens by themselves and they're applying, they don't find the effectiveness. But when we prescribe a sunscreen and they started using the sunscreen what we prescribe and the way we ask them to do it, definitely we have seen that difference. So they tend to have a better UV protection while using these sunscreens than the over-the-counter sunscreens.
Right. Before we wind up the session, Doctor, any do's and don'ts or things that people should remember before going for or buying a sunscreen?
Sunscreens, yes, definitely. While choosing the sunscreen, you need to look into the SPF and the PA plus, and whether it is a non-comedogenic sunscreen or a water-resistant sunscreen. And then you need to choose the sunscreen suitable for your skin. And definitely, it has to be applied generously in sufficient quantity to cover all the exposed areas. And it has to be repeated every 2 hours once, even when indoors. So, and if you're stepping out 20 minutes before stepping out, the sunscreens have to be reapplied. So, these are the important things which a person should know before applying the sunscreens.
Right. So the bottom line is no matter whether you are out or inside your homes or offices, you need to apply sunscreen on a regular and routine basis. So make sunscreen an integral part of your skincare routine. Thank you so very much, Dr. Sujay M. It was wonderful talking to you. Thank you for your valuable time and this very informative session.
Thank you, Samyukta, and thank you for the viewers, and thank you for the IPCA people who have provided this opportunity.
Thank you, Doctor. It was a pleasure. And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay happy, stay healthy. Goodbye. Have a good day.